Are you finding it hard to showcase the true value of medical affairs? You're not alone. For decades now, medical affairs has played a central role in pharmaceutical companies, building scientific credibility, engaging thought leaders, and generating data that supports safe and effective use of medicines. Yet, when it comes to demonstrating impact, especially to financial stakeholders or commercial decision makers, many of us still struggle. It's not because the value isn't there. It's because we often lack the frameworks to translate that value into business language. That's why, in this tutorial, I want to introduce you to three foundational pillars that can help medical affairs professionals, from MSLs to medical directors, showcase their work in a way that earns visibility, credibility, and strategic influence. These three pillars are strategic alignment with the organizational goals, business acumen, advanced communication. Each one of these is powerful on its own, but when they come together, they form a system that positions medical affairs as a true strategic function, not just a scientific one. Let's take them one by one, with real examples to help bring the concepts to life. Pillar 1, strategic alignment with organizational goals. Let's start with strategic alignment. To put it simply, if medical affairs is not aligned with the organization's top priorities, then no matter how much we achieve, it won't be recognized, valued, or even understood. Strategic alignment means that medical affairs knows exactly what the business is aiming for and actively supports those goals with meaningful, relevant medical activities. In other words, it's about being on the same map, not heading east when the company is heading west. Now let me pause here for a second and ask you this. Do you know your company's top 3 strategic goals for this year? Are they focused on a successful launch, expanding to a new market, differentiating against competition? If you're unsure, that's where the problem starts. Because without knowing where the business is going, it's impossible to prove that medical affairs is helping it get there. This alignment must be intentional, not accidental. Every insight you collect, every engagement you make, every data generation activity should somehow tie back to a broader strategic direction. Here's a concrete example. Let's say your organization is launching a new biologic in the immunology space. One of the top goals this year is to increase early diagnosis and time to treatment in underserved regions. If your medical team is simply executing traditional scientific exchange programs without that focus, you're missing an opportunity. But imagine instead that your MSLs design a targeted initiative with healthcare professionals in those underserved regions. You host educational webinars on the importance of early disease recognition. You help design screening algorithms in partnership with local associations. You publish a white paper summarizing the barriers and proposed solutions. Now, your work is aligned. You're not just doing scientific exchange. You're helping the company overcome a barrier to access and adoption. And when you report that 200 new patients were identified and treated earlier due to your initiative, that is strategic medical impact that ties directly into a business goal. It's no longer about activities, it's about relevance. Strategic alignment allows you to shift from simply doing work to positioning that work within the business context. So take time to map your key initiatives against organizational priorities. Involve medical teams in the early stages of brand planning. Speak up in strategy meetings and offer medical insights that shape decisions. This is where real impact begins. Now, let's move to the second pillar, business acumen. Medical affairs has evolved significantly, but we still carry some of that old reputation of being just the science people. And while scientific credibility is still at our core, today's medical leaders are also expected to contribute to commercial conversations, not by selling, but by influencing strategy through a sound understanding of the business landscape. So, What does business acumen actually mean for us? It means being financially literate, understanding concepts like market share, access pathways, payer priorities, and revenue drivers. It means knowing how brand teams think, how life cycle planning works, and how resources are allocated. It means being able to answer questions like, are we investing enough in this region based on its potential? How are medical activities supporting uptake in competitive markets? What's the value to patients from our latest real-world study? If you can't engage in these discussions, it becomes harder to show why medical affairs matters. Let's look at a practical example. Suppose your team is proposing a non-interventional study to generate real-world data on treatment adherence in a chronic disease. Traditionally, you might present this as a scientific opportunity. This data will fill a knowledge gap and inform practice. That's important, but it's only part of the story. Now, imagine you add this layer. This study will help demonstrate our product's impact on adherence in real-life settings, which can support inclusion in national guidelines and payer decisions. If successful, it could contribute to faster market access and improved reimbursement discussions in key countries. You've just linked a scientific initiative to commercial outcomes. You've made a case for investment, not just scientific curiosity. That's business acumen in action. You don't have to be an MBA holder to develop this skill. You just need curiosity, openness to learn, and willingness to collaborate with access teams, marketing, and finance. Ask questions. Sit in on cross-functional meetings. Learn how decisions are made. And then position your medical plans to contribute to those decisions, not exist in parallel. When medical teams combine science with strategic thinking, they stop being viewed as a support function and start being seen as partners. And now we come to the third and possibly most underestimated pillar, advanced communication. Here's a reality check. You can be strategically aligned and you can have business acumen. But if you can't communicate what you're doing in a way that resonates with your audience, your impact will be lost. Let's face it, communication has changed. In today's world, people have limited attention spans. Decision makers are flooded with reports, dashboards, and meetings. If your message isn't clear, concise, and compelling, it won't land. Advanced communication is not just about being polished. It's about being relevant. It's about telling the right story, to the right person, in the right way. You need to master both external communication with KOLs and internal communication with cross-functional partners and leadership. Let's explore a practical example. Your field team just completed a series of 12 KOL engagements across multiple regions. Traditionally, you might summarize the results like this. We engaged 12 KOLs, collected insights, and discussed unmet needs in disease management. That's descriptive, but it's not impactful. Now, let's elevate that. We engaged 12 regional KOLs to explore barriers to treatment initiation. Insights revealed that 70% cited lack of diagnostic tools as a primary barrier. Based on this, we collaborated with the commercial team to develop an educational toolkit, now being piloted in 2 key hospitals. Do you hear the difference? Now you've told a story. You've shown a problem, an insight, a collaboration, and a solution. And that's what advanced communication does. It builds bridges between what medical affairs does and what it achieves. It also means knowing your audience. When talking to commercial leads, emphasize how medical activities support uptake and differentiation. When addressing market access, focus on how your data helps justify reimbursement. And with senior leadership, cut to the impact. What did we change? What did we enable? What strategic question did we answer? If you struggle with this, one simple framework is the SPAR model. S, situation. P, problem. A, action. R, result. Use it in your slide decks, your insight summaries, your your strategy presentations. It's a proven way to structure medical communication in a business context. In the end, communication is not just about reporting, it's about persuasion. And when done right, it's what converts activity into recognized impact. Let's bring it all together. If you're in medical affairs today, you're probably working harder than ever, juggling scientific demands, data generation, stakeholder engagement, and more. But if you want your work to be seen, valued, and invested in, you need to ground it in these three pillars. Strategic alignment. Know the company's goals and link everything you do to them. Business acumen. Understand how your work drives decisions, investments, and access. Advanced communication. Learn to translate complex work into simple, relevant, and persuasive messages. These aren't abstract ideas. They're practical skills you can build one at a time, and they'll serve you whether you're in the field, at HQ, or leading a regional team. When these pillars are in place, showcasing the impact of medical affairs is no longer a struggle. It becomes a strength. Thank you for joining me. If you'd like to explore each of these pillars in more depth, check the resources and tutorials linked in the description. And if you found this valuable, don't forget to follow for more sessions on strategic leadership, evidence planning, and medical affairs excellence. See you next time.